Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. Thank you very much for joining us. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today and for these sessions. And we have, as always, with us our favorite Dr. Jan, Senior Medical Advisor of New South Wales Health. Dr. Jan, how are you?
Well, thanks, Jess.
Thank you for being with us today. And we have joining us also, we're so pleased, joining us online is Professor Julie Leask from the University of Sydney School of Public Health and Faculty of Medicine and Health, who will speak on the importance of raising awareness about seniors' health and also why it's important to keep vaccinated and also ensure that we know what to do with our resources as well. And we have some resources to share with you. But before anything else, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and emerging and acknowledge traditional owners. And although Aboriginal colleagues or members of the community who are joining us here today, we also pay respects to multicultural leaders and elders who are represented in this forum. So let's start. We have a question with Dr. Jan. We're well into winter now. Can you tell us what we're currently seeing in New South Wales with viruses such as COVID-19 and influenza? How are we doing?
So as people probably have noticed from being at work and being in the community, we're seeing fewer COVID notifications at the moment and fewer people being admitted to hospital, which is good. But what we are seeing instead are people getting sick with flu now. So we've seen a 15% increase in the last week of people being notified having had a test for a respiratory virus that they have flu. And we had more than 5,000 people diagnosed with a test with flu. And we know a lot more people won't have seen a doctor or won't have had a test. So definitely flu is about. We're also seeing people coming into emergency departments, and we're also seeing people now being hospitalised for the flu in greater numbers. One of the other viruses that we talk about is RSV, respiratory syncytial virus, and those notifications are stable. RSV often affects young kids with croup and bronchiolitis, so we're seeing that being stable, although some local health districts are more active than others. But we're seeing fewer of those tests positive. But the key message is that flu is definitely out and about, and flu is a very serious illness.
It's out and about, and we're encouraging people to take care of themselves and get vaccinated. And that includes the younger, the youth, the young people, the parents, as well as seniors.
That's right. So flu is a really serious illness, and it can be a serious illness at any age, but particularly we know for kids under the age of 5 and people over the age of 65, it can be a particularly serious illness. And we see a lot of very young and very older people, not very old people, but older people are hospitalised each year. The flu vaccine is available for everyone 6 months and over. It's available for free for certain age groups and people with certain illnesses that would make them more vulnerable to a poor outcome from flu. While we're talking about the flu season off and running, it's not too late to get vaccinated, and adults particularly can get vaccinated at their GP or at their pharmacist. And if older people need it, it's really important that we help older people get to a GP, get to a pharmacy to get that flu shot. I remember one year taking mum and dad, and they sat down on a bench while I ran to 3 pharmacies into the GP to see who could fit them in to get that shot done. And we just went to the first place that was available. And because I had younger legs and they had older legs, it just meant I escorted them to one location to get that vaccine. So it is important that we support older people to get vaccinated. It is really important, though, that people who are 6 months to 5 years get their free vaccine. Aboriginal people over the age of 6 months are eligible for a free flu vaccine. Pregnant women are eligible for a free flu vaccine because you know that flu can be bad for both mums and babies, so important to protect yourself and your baby. And people who have diabetes, cancer, autoimmune diseases, obesity, severe asthma, kidney disease, heart disease, lung disease, or liver disease over 6 months of age, all eligible for a free vaccination. Sometimes there'll be an administration fee from the GP or the pharmacy, but generally speaking, it is really important to prioritise that vaccination if you haven't had it so far.
Thank you, Dr. Jan. And we have some important resources or links and information on the chat. And you have any questions, please ask them. And we want a lively discussion. We have Dr. Jan and also Professor Julie Leask to answer your questions. And Julie, just wanted to ask, how important is it for people of higher risk of illness to really get vaccinated, especially those over 65?
Oh, hi, Jesusa, and hi everyone. And I'm speaking from Gadigal land, so I acknowledge the elders past, present, and the elders of the future. So it is very important, as Dr. Jan has said. Unfortunately, we only have 61% of people who are over the age of 65 having had their flu vaccine so far this year. So the cup is more than half full. But we can certainly do better in Australia, given that that vaccine is quite safe, and it's also going to reduce people's risk of severe disease. So particularly people over the age of 65 and all those other groups that Jan has mentioned, you see them listed there in the chat. It doesn't always stop the disease. As we know, sometimes we can still get flu, but it certainly reduces the risk of flu and also of getting severe disease, having to go to hospital. And we know that getting really sick really takes us out of our usual activities of being able to visit family and do the things we love. And so it can be incredibly disruptive for everyday life as well. So the answer is it is actually really important and worthwhile doing. So checking, whether you're due your flu vaccine and also your COVID vaccine is important.
And is the COVID-19 booster still important for us to get, and not just for everyone else, but especially for those high at risk and those who are older?
Yes, it is very important that the people who are at greater risk of severe COVID have that booster. And the booster is, we know we've seen a lot of recommendations and they change and it's hard to keep up with them. But people should have a booster if they're for COVID, if they're 6 months out from their last booster, or they are 6 months since their last confirmed COVID infection. So it's now a 6-month period. So it's worth checking now if you're due for your booster. Boosters essentially top up your protection against severe disease if you're in those risk groups. And, that is definitely the over 65. So the older you are, the more at risk you are from getting quite sick from COVID. The vaccines work reasonably well against severe disease. We know that, again, you can still get COVID even though you're vaccinated, but your chance of getting really sick is much lower. And I have some hard facts on that from some recent analysis that was done where Betty Liu and colleagues linked to the National Centre for Immunisation Research and Surveillance, linked the data from Australia on people who had died from COVID and whether they had vaccines or not, whether that be no vaccines, 1, 2, 3, or 4 COVID vaccines. And if I can just share the summary of that data, which is available on the website of the National Centre for Immunisation Research and Surveillance, it shows here, if we point to, say, the green bars, which are the people who had 4 doses, and this 84% bar is the people who had 4 doses, and it was between 1 week and 3 months of that 4th dose. And that 84% is their protection against dying from COVID if they're over 65. And then you see how that protection wanes. The protection against severe disease goes down over time. So by 6 months, it's down to around 56%. There's degrees of uncertainty around the actual range of that. But basically, you can see that it's much better to get that top up against protection from severe disease, particularly if you're older or if you're in a group which is at greater risk of severe disease.
Thank you, Julie. Seeing it like that as a graph actually makes you understand it more, isn't it?
And I think that's it, that it's not a one and done thing, unfortunately. We all love vaccines that are one and done. That's not what our COVID vaccine is at the moment. And that's why the booster is important, just to top up that protection, particularly for people who are more vulnerable to severe illness. And that includes people over the age of 65.
Dr. Jan, what else can they do? Okay, you get vaccinated. What else? We know all those rules, but you know, people who are seniors, it's hard. People should be advising, and what should carers do as well? What are the steps that we should be following?
Sure. So the first thing that we really are asking people to do is when they see their GP, whether it's by telehealth or in person, they make a plan for what they're going to do if they get sick. Now, that could be your GP giving you a pathology request form so that you can get a test done quickly and telling you where to get that test done. Or it could be making sure that you've got some rapid antigen tests at home to check if it's COVID. It won't tell you if it's flu, but it will tell you if you've got COVID, so that you can have treatment. And both flu and COVID can also both be treated by different antiviral medications that may make a difference to older people. And so that's why it's particularly important to have that plan. They can help prevent hospitalisation. One of the things that older people should also do is, if they know that they're going somewhere where they may encounter people who are unwell, wearing a mask is helpful. I mean, I still wear a mask on a train. Unfortunately, I'm, getting towards that period where my COVID infection and my vaccination may start to be waning off. So it's time for me to put my mask, not that I've ever stopped wearing my mask on the train, but it's really important that my mask is on again when I'm in, areas where it can be crowded and so on. Also, being really understanding with your family. And I think one of the things that it can get really important for family to be celebrating events, especially now that we can all get together and celebrate. But I think as an older person, it's really important for you to give permission for family members who aren't well to not come and visit you, and also to discourage them from visiting you if they're not well. And that way we can help prevent spread of infection from other family members to you. And that way also they don't feel guilty for not coming, because I think often when it's a special birthday, it's somebody's 90th birthday, everyone has to be there. Excusing, the grandniece or the nephew who's got, a sniffle may actually help a lot of people at that party.
Yeah. And I guess it's just that of being more understanding, isn't it? Of noting that we are trying to recommend people, if you are unwell, stay home, and that's okay.
Yeah, and I think that's the thing. I know not everyone can work from home and it can be really challenging. So if you have got a cold or a sniffle and you absolutely cannot stay at home, then make sure you wear a mask and maintain good hand hygiene. But as far as you can, limit your interaction with people who are vulnerable to severe disease. So if you know you've got a friend or family member with cancer, diabetes, asthma, or if you've got a friend or family member who's elderly, please try and limit your interaction with them.
Thank you, Dr. Jan. Professor Leask and Julie, why, with your research, what have you been finding out and what people have been asking about vaccination and behaviors that you've learned?
Yeah, so we have a research group at the University of Sydney who look at social and behavioural insights in immunisation. And one of the wonderful things that I've had the privilege of doing lately is running community workshops with multicultural community leaders, refugee community leaders as well, through the STARTS team. And we have heard from communities who have their ear to the ground that there's a lot of need to know where we're at now with COVID. They don't feel like they've heard as much unless they go, actively looking around about COVID. We don't have those 11 a.m. press conferences anymore, of course. So where are we at with COVID? Is it still affecting people? It's helpful to share the information about the burden of COVID disease. It's still around who should be vaccinated, when, how, those sorts of practical questions. And then we also ask communities about what sort of concerns they've heard about COVID and vaccination. There's a sense that some communities feel like they were told that 2 vaccines would be enough, and now they're being asked to have 3 or 4 or more vaccines. When is it going to stop? And are the vaccines safe? Is the health problem I have, was it triggered by the COVID vaccine? Why should I vaccinate? I was made to vaccinate, and now, you know, because I don't have to vaccinate, I prefer not to. So there are some real there's some real issues that communities have been welcoming the chance to raise and ask questions about, which is, I think, is incredibly healthy. And it's also good to have that kind of debrief, because COVID was hard on people, and having the chance to talk about that and to talk about the remaining questions and concerns that either they have as leaders or their communities have is really helpful, because we can then help address some of those questions or just empathize with them, and figure out what might be true and what might be misinformation, and where there is actual uncertainty. So yeah, I think it's been very helpful to hear from communities and to be able to try and address some of those questions as well. And I think for the people on the call today, your role as communicators with multicultural communities is so important, just to keep them up to date with COVID and flu and all the other vaccines that are recommended to people, and help protect them against severe disease.
Thank you, Julie. And I think that is important, that no matter how, it's been 3 years, but it is around. It's still, COVID is around. There's other diseases as well. And so these questions will arise, and where do we go to get those answers?
So I think one of the first things is acknowledging the fact that everyone is still learning. The whole COVID journey, it's hard to believe it's only, 3.5 years. But if you think about the huge amount that we have learned about this particular virus, about how it spreads, how it changes, and what it's doing to evade some of the things that we had hoped that, 2 would be enough. But we've learnt. And I think it's so important to say that we're still learning, and the importance of us learning and bringing that information to people so that they can make informed decisions about, having a booster, and providing information like, this is why we're saying the booster is important, that we have learnt that having this booster will help protect you. And particularly when we've just had, a big upsurge like we've recently had, we're on the downslope now, but even on the downslope, there'll still be people getting sick, because there's still numbers in that downslope as it goes down. So it's important that people do keep looking for information. We put out information every week about what's going on, and we also put out information about how to protect ourselves. And when the information changes, it's important to go to reputable, trusted people to make sure that the information about what's changing and why it's changing is being looked at clearly and at a way that people can understand. And that's what we try really hard to do within New South Wales Health.
Yes, and I take your point, Julie, that there are many questions, and the people on the call, we have this responsibility, which we're doing now, is to present information that are accurate and trusted, but also community leaders play a part in guiding people to the right information. Jan, do you think that that's the way to go? Because you've been attending some forums too.
Julie's done a lot of research in how to help people who may be hesitant or concerned, and may have some really good hints for helping people who are hesitant, how to help them think about what's going on.
Julie, is that the case in terms of what we should be doing, and as community leaders that you've been seeing, and how they could be guided to relay the right information?
Yeah, absolutely, Jesusa. Community leaders, community and religious leaders are actually very powerful influences when it comes to vaccination. And we know that so many got on board with COVID vaccination and the rollout. And what we've been trying to do in the workshops is to try and empower and educate and give confidence to community leaders to talk with their communities about all vaccinations across the whole of life. And, some of the things that we talk about are when someone in your community is very hesitant to vaccinate, it can be very easy to just jump in. And if you want to be an advocate for vaccination and that they say something isn't quite correct or you disagree with, is to jump in and try and correct their wrong thinking straight away. So we talk with people about the need to avoid that kind of righting reflex and just sit with that and listen to them and hear about their experiences and validate them as a person and their experiences. And then offer to share information that you have. So there's listening, understanding, empathy, and sharing of information, but also encouraging people, if they're willing to consider vaccination, to have the vaccines that are recommended for them, because it can help protect them. So to be advocates, it's okay to be also encouraging people if that person is open to possibly vaccinating, even though they're hesitant, and knowing also when to maybe, change the subject. And I often tell the groups that I come from a family where my grandmother was very much against vaccination. And, my aunt, who's now 84, was just saying to me, oh, no, we're anti-vaccine. So that's her label, not mine. But that part of my family, I know how strongly they feel about vaccination, and I don't actually debate with them about that because I'm not going to change their views. They're very strongly felt. But I know there are plenty of more people who are just on the fence or concerned or unsure, want questions answered. And so teaching community leaders how to have those conversations and giving them a bit of knowledge to impart as well is so crucial. And we've learned that in our global research as well. Globally, we know through our work with WHO, UNICEF, and other groups that community influence, social influence is very powerful when it comes to vaccination, and we should work with that.
Thank you, Julie. And here in New South Wales, we have partnered with a lot of religious leaders and community leaders, and our health workers have been able to deliver those messages. But keeping up to date with information is crucial.
And I think that's the hard thing when things change a lot. It can be really hard to keep on top of things. And even the latest research can be, people will ask you a question, and I have to honestly say sometimes I don't know about that. I will go away and find out, and I'll come back to you when I've got a better answer. And I think saying when you don't know something is also about being honest, because medicine is so broad. COVID and the amount of information about COVID is so broad. I think any individual who says I'm an expert in everything is possibly a dangerous person sometimes.
That's right. Now, Julie and Dr. Jan, I wanted to ask about, we talk about vaccination for seniors, but it is important to just keeping well and healthy. And there are a lot of programs out there and ways to encourage our family members who are over 65 to keep healthy.
And I think that's one of the really important things, is that what we do know is it's never too late to improve what you're doing with yourself. And I know it can be a really, really big challenge sometimes when we've got older, and it's harder to start things sometimes, but we've got some really good programs available in New South Wales to help people stay healthy. First thing to do is make sure you do stay in touch with your doctor. As we get older, our risk for all sorts of things can increase. And some of these things are really quite silent, like blood pressure problems and so on. So staying in touch with your doctor can mean that we can pick up things like high blood pressure or diabetes early before they get a chance to do damage. Really important to stay physically active. We know that as we get older, our ability to maintain our muscles can go down. And so even spending, 3 or 4 days off our feet can actually have quite a detrimental impact to us. So doing everything we can to be up and around even when we don't feel like it. I know on these cold, wintry days, I've had arthritis since I was a little girl, and gee whiz, I know about it at the moment, but I'm making myself, go, nah, got to get up, got to get on, got to get doing things, because otherwise it'll just be that much harder when I want to go and do more. Exercises to improve your balance and strength are really important as we get older, and particularly making sure that we stay stable on our feet. Get Healthy is one service that's available. We also have Healthy and Active for Life online as a resource that's available for people. I know not everyone uses a computer, so you can do it with a younger family member to help work with you. Also, we have a program that's available through a number of community facilities called Stepping On. And that's a really good program to help prevent falls in people aged 65 and older. And I know falls sound really, really boring, but they can really be a life-changing event for an older person. They can lose their independence. They can have a lot of pain after a fall. It can be a really terrible thing to have happen. And if we can prevent it by doing some exercise and by changing our environment a little bit, about looking for things, my parents' home was an occupational therapist nightmare, because they had some holes in the carpet that they'd put mats over that were just trip hazards galore. And so just even having a way of looking around your house to see, what could I do to make it easier to walk from part A to part B of the house can make a huge difference to your ability to stay at home and stay independent for longer, which I think is what most people want. We want to be healthy, active and independent for as long as we can be. And the Stepping On program, it's not about, lifting huge weights or doing anything. It's gentle group exercise. But, for other people who are up for more, then do as much as you can. What we've learned a lot is it's not about your chronological age, it's about your physiological age. And people are able to do amazing things.
Thank you so much, Dr. Jan. And Julie, based on your studies about seniors' health and older people, it is also important to take care of those who are caring for older people.
It is, that's right, Jesusa. And my colleague, Dr. Majdi Sabahelzen, just popped by, so I dragged him into the office to join us. It is so important for people who are caring for older people to make sure that they sustain their own energy levels, have respite, keep their mood healthy. And that can be incredibly difficult when you might be, I'm thinking about my father-in-law, for example, who cared for my late mother-in-law for 7 years, very intensively. And he himself is quite aged. And that was a huge thing for him to do. And he did it beautifully. But having the services around and using what's available to you is so important, just to sustain yourself, because it is a long haul. It can be a long haul, and drawing on family as much as you can is so important. Looking after yourself, your nutrition, your mental health, all of those things are important. I know they can sometimes be very difficult to do when you're busy in a carer role, but they're incredibly, incredibly important, because you're going to be a better carer for it. And I say that as a former nurse as well.
Thank you so much, Professor, for joining us as well. I just wanted to say that we say we're taking care of carers. We're saying the carers should take care of themselves, but what about the carers and giving support to those caring? Because that is a very difficult responsibility.
It is really hard, and supporting people who are caring and really acknowledging the immense amount of work. And sometimes that's all somebody needs to know, is that I see you and I haven't forgotten you. They may be too tired or may not want to engage at the moment, but just not forgetting to keep putting out those invitations, because it could be the week that somebody's in respite. It could be the day that somebody's in daycare that started new. And so giving those carers the ability to stay connected, but also older people as well who may become more socially isolated. They may not be able to get to the social groups that they used to. They may not be able to make the connections with the people they used to. Helping people, the carer may not be quite across technology. I know, for example, in my family, we've looked after my mother-in-law by helping her with tech, we're the IT support crew, and that's meant that she's been able to keep in email, she's been able to keep in contact with people whilst caring for my father-in-law with dementia. So I think it's one of those things that Younger people can support the older people, they can support the carers of older people, often by providing that sort of keeping doors open and helping older people stay connected.
Thank you, Dr. Jan. And of course, there's that mental health, at keeping everyone just connected. And you always say this, and I remember, just keep in touch with some people, give the people a call.
Absolutely. Looking for who you haven't seen for a while and reaching out to that person to see how they're doing, because we do know that, people do withdraw when they're feeling isolated. And one of the great challenges of aging is that you do lose a lot of your peers, and you lose a lot of the people who you've known and been able to talk to for a long time. So being able to help people make new bridges and find new communities is important throughout the lifespan, but particularly as we get older.
And also, if there are people who wanted to call a mental health line, there is in language available.
Absolutely. And support for people of any age, that transcultural mental health line on 1-800-648-911. We've spoken about the importance of that service before, and having that culturally specific care is so important to people.
Thank you, Dr. Jan. I know we've run out of time, but there is a question by Dr. Nargis Banu, and I'll pass this on to Professor Julie. Looks like COVID has changed. Their symptoms have changed a lot. Is that what you found in your studies?
Yeah, I'm not completely clear on what the question might be. It was put there in relation to some of the concerns that community members had. So certainly there are some people who can get lingering effects of COVID itself. Sometimes we have a COVID infection that goes on for 3 months or more, and on, and we call that long COVID. And it has some of the similar symptoms to COVID itself. So yeah, forgive me if I'm misinterpreting that comment, but it's not completely clear to me what the question there might be.
Yeah. So maybe I think it's just important to go into, if you have any questions, maybe go into the New South Wales Health website, and where there's information on COVID, and we will be sending out information in language as well. And if you have any questions, please let us know, and we'll try to get those questions for you. But we've run out of time. Dr. Jan, any last words for the community, for the media that's joining us online?
Oh, just to say how important it is that older people can stay fit, healthy and active. And even if they're not feeling all that healthy, staying active and mentally engaged with others is super important. So do what you can, and check in with your GP if you haven't checked in with a while.
And Professor Julie Leask, thank you for joining us. Any last words for the community and the media online?
Go to the New South Wales Health website for vaccinations. Just have a look at the vaccination schedule and what vaccines you might be due. And also there's some fabulous links that the team have put up here, including translated resources as well that are available on the website. So just have a good explore of that website, so the people that you're communicating with are up to date with the latest recommendations.
Thank you so much for joining us, Professor Leask and Dr. Jan, and to you who's joined us online every fortnight. We will be back in another 2 weeks, but we appreciate your time and effort, and we will have this recording on the New South Wales Multicultural Health Communication Service website. We'll also send the recording link and resources. We have multicultural media resources available for you. That's going to be in your email shortly. Have a great afternoon, and we'll see you again next time.